Have you ever dropped something heavy on your foot, gotten kicked during a soccer game, or stubbed your toe on bedroom furniture in the middle of the night? If so, you've likely experienced a contusion, or what we commonly call a bruise. Today, I'll be talking about what causes foot and ankle contusions, how to treat them effectively, and most importantly, how to prevent them from happening in the first place. But before I get started, I'd like to introduce myself. I'm Dr. Rion Berg, and I've been practicing podiatry for over 40 years in Seattle, Washington. If you find the information in this video helpful, please remember to subscribe, hit the like button, and then hit the bell so you can receive a notification every time I release a new video. A contusion or bruise occurs during an injury when the muscle fibers, blood vessels, and connective tissue gets crushed without breaking the skin. You'll notice swelling, blue, purple, or even yellow discoloration, which is all a part of your body's natural healing response. Foot and ankle contusions occur frequently in athletes from direct trauma during sports, for example, being hit by a baseball, kicked during soccer, or falling when you make a play in pickleball or tennis. But you don't have to be an athlete to experience a contusion. Everyday activities can cause them just as well. Stubbing your toe on furniture, getting your foot stepped on in a crowded area, dropping a heavy object on your foot, wearing poor-fitting shoes, either too large or too small, these can all cause repeated toe trauma, leading to black, loose, or deformed toenails. While most contusions heal quickly on their own, more severe ones can cause complications and require extensive healing, so proper treatment is essential. It's important to see your podiatrist as soon as possible after a significant foot or ankle injury. They can rule out more extensive damage like fractures or ligament tears and guide you to the quickest recovery. Your doctor may recommend imaging tests such as an X-ray, CAT scan, or MRI to assess the full extent of injury and rule out any underlying damage. For immediate treatment of a contusion, remember the acronym RICE. Rest, avoiding put weight on the injured area. ICE. Apply ice for 15 to 20 minutes every 2 to 3 hours during the first 48 hours. C for compression. Use an elastic bandage to reduce swelling. And E for elevation. Keep your foot elevated above heart level whenever possible. This protocol helps minimize swelling and speeds up the healing process. In addition to the RICE rule, your foot doctor may also recommend non-steroidal anti-inflammatory agents like ibuprofen, which can help reduce pain and inflammation. Light stretching. Once an initial pain subsides, gentle stretching of the affected muscle can prevent scar tissue formation. Activity modification. Limiting your sports and high-impact activities may be necessary depending upon the severity and location of your injury. A walking boot and crutches. Minor contusions may heal within a few days without any restrictions, while more severe ones may require you to keep your foot immobile and non-weight-bearing for several days or a week. While you can't prevent every accident, you can significantly reduce your risk of foot and ankle contusions with the following strategies. First, choose the right footwear. Purchase shoes specifically designed for your sport. Running shoes won't provide adequate support for tennis or pickleball, and vice versa. Test your shoes for stability. They should only bend at the ball, not in the middle, and they should be difficult to twist like a rag and have a firm, stable heel counter. Replace worn-out athletic shoes. Check the tread on the bottom. If it's significantly worn, it's time for new shoes. Remember, athletic shoes should be replaced about every 500 miles or once or twice a year, depending upon how active you are. Be aware, accommodate to your environment. Inspect playing fields for divots or holes or uneven surfaces. Be mindful of surroundings during daily activities to avoid stubbing toes or dropping objects on your feet. For example, use a nightlight if you get up frequently during the night. Wear protective footwear in high-risk environments such as construction sites. Finally, some other ways to prevent falls when playing sports are always warm up and cool down when engaging in your sports. I recommend you use dynamic warm-ups before you begin and static stretching afterwards. I've placed some videos above about these two types of stretching. Build up your distance and play time by no more than 10% per week so your body has a chance to recover. Engage in balance and core strengthening exercises. If you're active in sports, be aware that contusions aren't the only injuries you might face. Other common sports-related foot problems include heel pain from plantar fasciitis, Achilles tendonitis, stress fractures, and ankle sprains. Many of these conditions share similar prevention strategies, particularly wearing proper footwear and gradual training progression. Most foot and ankle contusions heal well with proper care and rest. However, if you experience severe pain, significant swelling that doesn't improve, or have concerns about your injury, don't hesitate to make an appointment with your podiatrist. Early intervention can prevent complications and get you back to your favorite activities faster and more safely.